Our next presenter is Brittny Fredriksen. She's a fourth-year PhD in epidemiology student. Her dissertation work is on nutritional and genetic factors that put kids at increased risk for type 1 diabetes and its autoimmunity. And she's published 2 papers on vitamin D genes in this area, and she's going to talk to us about a 3rd paper that she's published.
Thanks, Jill, and thank you all for being here today. I'm really excited to share this work with you. I've been working on it for a while now, and it's exciting to share it. So I'm going to be talking about infant exposures and development of type 1 diabetes. So for those of you unfamiliar with type 1 diabetes, it's an autoimmune disease in which the insulin-producing beta cells of the pancreas are destroyed. And there's typically a preclinical phase of circulating autoantibodies, referred to as islet autoimmunity, that precedes this clinical diagnosis of type 1 diabetes. And a number of prospective cohort studies of children at increased genetic risk for type 1 diabetes have been able to identify this intermediate outcome and then use it as an outcome before the clinical diagnosis of type 1 diabetes. So the cause of type 1 diabetes is still unknown, although genetic factors as well as environmental factors have been implicated. And the incidence of type 1 diabetes is actually increasing in children under 5 years of age. And so that leads us to believe that maybe it's something going on in that early life period or possibly in utero. So one of the hot topics has been infant diet or solid food introduction. And in 2003, Jill and colleagues found that early introduction, if you introduce solid foods or cereals before 3 months of age, or late introduction if you introduce them after 7 months of life, that when you compare this to those that were introduced between 4 and 6 months of life, which is usually when pediatricians are recommending introducing solid foods, this was associated with an increased risk of islet autoimmunity, that preclinical phase of type 1 diabetes. At the same time, another prospective cohort study in Germany called Baby Diab found a similar increased risk of islet autoimmunity with early introduction of gluten-containing foods. So here it was gluten. In Jill's study, it was cereals, both gluten-containing and non-gluten-containing. And then more recently in Finland, there's another prospective study called DIP, and they found early introduction of fruits and berries, as well as root vegetables, were associated with an increased risk of this preclinical phase of type 1 diabetes. And so as you can see, a number of solid food exposures have been suggested, and we haven't really settled on what is the actual antigen or exposure. Another interesting finding from the Jill study in 2003 was that children who were breastfed when first exposed to cereals, this was associated with a decreased risk of islet autoimmunity. And I'll discuss this a little further in my talk. So the study I want to share with you today is what we think that it's the first prospective study of infant diet and type 1 diabetes. And we wanted to look at a number of infant exposures and their association with this clinical outcome, which is really of interest to most people. So for those of you that haven't heard of DAISY, it's the Diabetes Autoimmunity Study in the Young, and it's composed of 2 cohorts of children. Over 30,000 children were screened for high-risk HLA genotypes or increased-risk HLA genotypes at St. Joseph's Hospital here in Denver. And they were enrolled if they had these increased HLA genotypes. We refer to that as our general population cohort. We also have a sibling offspring cohort, and these children were recruited if they had a sibling with type 1 diabetes or a mother or father with type 1 diabetes. So DAISY now has 2,547 children. So DAISY subjects complete clinic visits at 9, 15, and 24 months of age, and then annually thereafter. And type 1 diabetes is diagnosed by a physician using American Diabetes Association criteria. The data for this infant diet were collected during telephone or face-to-face interviews at 3, 6, 9, 12, and 15 months of age. And then for this particular analysis, we tried to see how parents would interpret the pediatric recommendations to introduce solid foods between 4 and 6 months of life. And so we categorized anything before 4 months of life as early, and anything on or after the 6-month birthday as late. And we compared that to those that were introduced to solid foods in the 4 to 5 month period. We used Cox proportional hazards analyses to calculate hazard ratios and 95% confidence intervals. So we wanted to, as well as solid food introduction, we wanted to look at breastfeeding also. And we created a new breastfeeding variable, which we called breast milk months. And this really gets at the relative quantity of breast milk based on the proportion of breast milk to formula over the first 9 months of life. And I've included an example calculation here. So this child was exclusively breastfed for the first month of life, so they get a 1. And then the next month, they received on average 6 servings of breast milk per day and 1 serving of formula. And then we added this across to arrive at 7.17 breast milk months. It's kind of similar to pack years in smoking. And we also looked at 3 variables that get at the breastfeeding while introducing certain foods. So we looked at, was it any solid foods, cereals, which was looked at previously, or gluten-containing foods, which has been looked at with celiac disease. So as I mentioned, we have 2,547 children in DAISY. We wanted to limit this analysis to our birth cohort, which are children that have a clinic visit before 1.35 years. And then we wanted to ensure that these children had complete prospective exposure data. So we arrived at 1,835 children, of whom 53 developed type 1 diabetes. So just a few demographic characteristics. The children that developed type 1 diabetes were more likely to have the high-risk HLA genotype, and they were also more likely to have a first-degree relative with type 1 diabetes, particularly a father or sibling. We looked at a number of perinatal characteristics. We looked at birth weight, 9-month and 2-year weight growth rate, the season in which the child was born, delivery type, and exposure to maternal and smoke in utero. And the really only association we found there was complicated vaginal delivery, was associated with an increased risk of type 1 diabetes. And this wasn't surprising to us because we had done a similar study with the preclinical outcome of islet autoimmunity and found a similar association. However, the mechanism is not quite clear, whether it's stress on the fetal immune system during that complicated vaginal delivery. We don't know, but it's in comparison to those that had an uncomplicated vaginal delivery. So the majority of our findings came with the early infant diet. And we first started out with any solid foods, early introduction to solid food or late introduction to solid food. And we found almost a 2-fold increased risk of type 1 diabetes in children that were exposed to solid foods before 4 months of age. And then almost a 3-fold increased risk of type 1 diabetes in children that were exposed to solid foods after 6 months of age, or on or after the 6-month birthday. And so we kind of wanted to get at what foods might be driving this association. So we again looked at the cereal variable that includes the gluten-containing as well as the non-gluten-containing cereals. And we found an increased risk of type 1 diabetes with late introduction of cereals. However, the early introduction was marginal. And then when we broke the cereals down into the various components, we found that late introduction of rice and oat was associated with an increased risk of type 1 diabetes, as well as first exposure to fruits. And these are solid fruits, and we excluded any sort of fruit juice. When we looked at our breastfeeding variables, we don't see anything with exclusive breastfeeding or breastfeeding duration. Our breast milk months variable was marginal. But our most intriguing finding with breastfeeding was that breastfeeding at introduction to wheat or barley was highly protective, with a hazard ratio of 0.47. And then we wanted to see, what if we put all of these variables into one model and see how they kind of act together? So our breastfeeding and introduction to wheat and barley remains significant, as well as our late introduction to rice or oat. But our early exposure to fruits became marginally significant. So we were kind of wondering, what's going on with this late introduction to rice or oat? And as many of you know, rice cereal is probably the most common solid food introduced here in the US, and it was so in our DAISY children. Most were introduced to rice or oat cereal, but some parents chose to mix. We were able to look at the very first food introduced, and some parents chose to mix rice and oat cereal with fruits or vegetables, and so it's really difficult to separate what is the actual antigen here, or what is the actual food group responsible. So we did a few comparisons of those mothers who introduced rice or oat late compared to those that introduced it earlier according to the recommendations. And mothers that had type 1 diabetes were more likely to choose to introduce solid foods later. They also tended to be older mothers and more educated mothers. And probably not surprising, they chose to exclusively breastfeed and partially breastfeed for a longer duration and had a greater number of breast milk months. And then if they chose to introduce rice or oat later, they then proceeded to introduce all other solid foods later. So I think a common question that can come out of this research, the American Academy of Pediatrics recommends breastfeeding for about 6 months. And so moms are probably saying, what if I want to follow those recommendations? When do I introduce solid foods? And so we did a kind of sensitivity analysis to get at this, and 42.3% of the children in our late category for introduction to rice or oats were introduced to them on their 6-month birthday, which just shows there's a propensity to introduce solid foods on a birthday or a milestone. And when we put these children into our reference category of 4 to 5 months, which is just a difference of 1 day, the adjusted hazard ratio increased to 4.28 from 2.88. So this is suggesting that it's not those moms that are introducing rice or oat on the 6-month birthday. It's more likely those that are choosing to delay introduction even later than 6 months. So another common question is, what are the mechanisms that are driving these associations? And some hypotheses out there. For the early introduction, it could be this abnormal immune response to a solid food antigen, whether that be any solid food, a gluten, rice or oat, while the gut immune system is still pretty immature when the child is less than 4 months of age. The late introduction is a little harder to explain. It could be that these children are receiving a larger amount of the exposure at initial introduction. So a 7-month baby may eat a cup of cereal as opposed to a spoon of cereal when they're 3 months old. And it's more likely that the mom's not breastfeeding any longer at introduction if she's waiting a lot longer to delay. So the child may not be receiving those protective effects of the breast milk. And as we saw that protective effect with breastfeeding at introduction to wheat or barley, this may protect against an abnormal immune response to these potential antigens, possibly gluten antigens, in the immature gut. And then we saw that individuals who choose to delay the first exposure to rice and oats, they tend to delay the first exposure to all foods. So maybe after 6 months, these children are missing key nutrients if they're not being exposed to any solid foods. So in conclusion, while much of the focus of infant diet and type 1 diabetes research has been on the timing of introduction of a single antigen, people have really focused on cow's milk or gluten. This data suggests that it's probably multiple foods or multiple antigens that are playing a role, and that this relationship is quite complex between the timing and the type of infant food exposure. However, our research supports that there does appear to be a safe window in which to introduce solid foods between 4 and 5 months of age. And this research supports, as well as other research, that solid foods should be introduced while continuing to breastfeed to minimize this risk in genetically susceptible children. And I think the importance of this research is really that we can inform recommendations, or at the very least, assure mothers that are following the recommendations that they're not causing their child to be at any increased risk. And so the previous studies with islet autoimmunity were able to inform a lot of recommendations or position papers, especially this European one, that I actually really like, and I think it really gets at what we're trying to say, that exclusive or full breastfeeding for about 6 months is a desirable goal, and I think we would all agree. However, complementary feeding should not be introduced before 17 weeks, which is 4 months, and not later than 26 weeks. So this is very specific, but I think it's an example of where this research can be used. And I'd like to acknowledge my co-authors on this work, and my mentor, Jill, for all of her guidance, as well as the DAISY staff and all of the participants without whom this research would not be possible. Thank you.
Because of other things I'm involved with, there's a lot of difference sometimes between supplemented, so cereals that are supplemented with a lot of micronutrients versus non-supplemented cereals. And is there a difference in the introduction that if the child is older, they're
Yeah, that's a great question. I'm actually not able to determine what kind of cereals they are from our data. We could go back and look at specifics. So I don't know, but that's an interesting thought, that maybe they're better solid foods early on as opposed to later.
Are there micronutrients that can play a role early that aren't in the mix later or whatever?
Exactly. No, that's a great thought. Thank you. Any other questions? Tom?
Brittany, you found similar or identical things in the same cohort with autoimmunity as an outcome and type 1 with diabetes as an outcome. Is this surprising or not? What does it tell us about the mechanisms of disease? And how do these associations be replicated with some of the other cohorts?
Yeah, great question. So it it is similar to what was found with islet autoimmunity, although that first study with islet autoimmunity and DAISY focused solely on cereals, which included the gluten-containing and non-gluten-containing cereals. So those associations were cereals. Other prospective studies, like I said, have found other foods, but maybe sometimes when I think about it, it kind of gets down to maybe it's just early introduction of anything. And the late introduction is a little more difficult. But this research is being replicated in TEDdy currently, which is a multi-center study with sites in Germany, Finland, Sweden, and the US. So maybe that'll give us some clarity, or maybe not. It might just be really complex. Yeah, that's interesting because it's a question that comes up. Obviously, the study can only speak to high-risk children, but I think the recommendations that the American Academy of Pediatrics has put out are recommended for all children, high risk, low risk. So I think following those guidelines, and when you kind of look on the American Academy of Pediatrics websites and why they came up with these recommendations, it's really that early introduction, the child is not developmentally ready to take solid foods. And children show, I don't have children of my own, but children show a sign that they're ready to consume solid foods, grabbing at yours and things. And they also say that maybe later you're just not receiving the amount of nutrients you need from breast milk alone.